Hello, this is Mike Andrade with the Solving Healthcare podcast. And today I am super lucky to have a local direct primary care physician. Dr. Lola Asheye is our guest today. And Lola, thank you so much for being a part of this podcast.
Thank you. I'm so happy to be here.
So, one of the things that I hear from a lot of individuals or a lot of complaints is that healthcare is so dang expensive and getting the right healthcare is super crazy. And I talk a lot about direct primary care as being a huge opportunity, a huge solution to solving a basic healthcare need. And so it's just a blessing to have an actual DPC doctor on the show to give a little bit of perspective as to what you do, why you do it, and what are those outcomes. And so would you mind giving me just a brief introduction as to your practice and how long you've been in practice?
Yes, absolutely. So the name of my practice is InTouch Primary Care. It's in Sugar Land, Texas, like Mike mentioned. And we are a direct primary care practice, which means that it's membership, which means that people can get to see us very easily. They can come in same or next business day. They have direct access to their doctor. They can text, call, email me directly in between their visits. And then we have a lot more time with each patient. So we can spend our time listening to the patients, learning about our patients so that we can take care of them, as soon as possible. So it's a great model.
Yeah, it's a fantastic model, and you've given a bit to unpack, but let's talk about why primary care. And when I talk with folks about primary care, they say, well, what's my copay and why am I paying a membership fee? And what I typically say is, why are you paying insurance for something that's basic that you know that you need? And so can you talk a little bit about why is it a membership fee and how you work with insurance?
Yes, absolutely. So it's membership because that is the best way to care for our patients. And I know people don't fully understand it, and there's a lot that needs to be understood there. But when it's membership, we work directly with our patients. When people go through their insurance, the incentives are not really aligned, because think about it, you pay the insurance company and then the insurance company decides whether or not they're going to pay your doctor. Unfortunately, the insurance company doesn't know who you are. You're an individual, you're just a number to them. And so when they do decide to, whether or not they cover your services is entirely up to them. It's not something that you have much control over. And that really creates barriers to care for a lot of patients, because we're waiting on a third party that doesn't really understand what you need to approve your care. So by just removing that piece and having a direct financial relationship with our patients where they're members, it really helps us work much better together. And it really actually most of the time makes things cheaper. So
and we'll talk a little bit about that, but what I want to make sure we unpack, and I hope I don't say that word too much, is just quite honestly, it's the economics of insurance don't serve you as a physician, because so much of your time is spent with paperwork. So you don't have the time to dedicate to good medicine when you're in an insurance world. Is that a fair statement?
That is exactly right. And I think people don't realize how much time it takes us to, because of the insurance piece, not just time from the doctor, even time starting at the front desk. From the moment you walk into a doctor's office that processes insurance, they have to check to make sure that we take your insurance. That takes time away from your visit, right? Because your appointment is at 1, you get there at 1, all that stuff takes time. And then, you get into the room. Some of those metrics that the medical assistant is collecting has really nothing to do with you or what I need. Some of them just are purely insurance based so that we can get reimbursed. So there's so many things that make it inconvenient in when you process insurance.
Yeah, so talk a little bit about the impact that getting away from insurance for primary care. What has that done for you as a doctor in terms of time you can focus on your people, but also the quality of the outcomes that you can impact as well?
Yeah, it's huge. difference, because number one, I can say that we offer same or next business day appointments. That is almost impossible when you take insurance. And that's huge, because when people are sick, they want to feel better quickly, and waiting weeks, a month sometimes to get in to see the doctor makes things more complex, makes things worse. So that's one of the things. The other thing is the time I get to sit down and actually get to know my patients. So, it's not a quick 8-minute visit or 15-minute visit. Some of our visits take up to an hour. It's however much time a patient needs to figure out what's going on. So that makes a huge difference too.
Yeah, and you know what's funny is that as you're talking, I'm thinking about my doctor who told me once, I came to him for two things, and he said, "Hey, Mike,
Pick one.
I can only see you for one, and I need you to reschedule for the other because insurance only." And I'm like, "Dude, really? It took me 2 weeks to schedule this appointment, and you expect me to make another one?" I was like, "We're just doing both today, and if you want to bill me, go right ahead." And so we ended it at that. But the challenge that I forget where I was going with that, but the time that you get back, most primary care doctors have a patient base that's 2,000 to 3,000, and you might have a different statistic than that, but
well, that's right.
yeah. And so that's why you only get 7 minutes, and that's why care typically gets referred to a specialist, because you've got a tiny nugget of time that you can qualify an illness, and then you have to refer to somebody else. Is that a fair statement?
Absolutely. So I was talking to somebody recently, and I said, in the direct primary care model, the tenant, you just don't refer quite as much, because now because most of the things that we referred for, not most, but a lot of things we referred for are things we probably could figure out, but we just didn't have the time to do it. Yeah. But now in this model, we do have the time, and so we do it. So it makes a huge difference there too.
So talk to me about, so I think of things like in terms of the license that you have as a primary care doctor. What I've always been told is that when you have fewer patients and you don't have to worry about insurance, things like diabetes management, weight management, cardiovascular health, and all of those things, you have more time. So can you talk a little bit about how you're able to serve the needs of chronically ill folks, and how that is so much better in a direct primary care world?
Yes, absolutely. So I'll give an example, a story about a patient that I had that had leg swelling. So his legs were swollen. He'd seen three different doctors. One was a primary care doctor and two other specialists. And while nobody could, they were doing several tests for him, he came in, and it took 45 minutes into the conversation of trying to figure out exactly what he's taking, why he's taking certain medications, because they had a long list. Come to find out, he started one medication a few months ago by a different doctor. So this is like a fourth doctor. And we stopped that medication, and 2 days later, the swelling was better. 2 weeks later, it was completely gone. So this is swelling he's had for about 2 months, that he had seen 3 different doctors to try to figure out. And it just took a conversation, listening, and trying to figure out what was going on to find it. So I think people really undervalue how important it is that your doctor actually has time for you to listen and figure out what's going on, because it makes all the difference.
And it's overwhelming, the difference. And so how do you help, in addition to being able to provide a deeper level of primary care and chronic condition or chronic management, how are you able to save folks money when you have to send them out of your office?
Yeah, so that's big, because the truth is, like I said, with primary care, we can do 80 to 90% with diabetes, high blood pressure, high cholesterol, all of that. But we're able to save money because we can directly work with other parties, like labs, for example. We can offer them very heavily discounted lab pricing, for example. So that gives us flexibility in where we send our patients. Also, for imaging and even medications, we're able to find a lot of options for patients outside of the usual options. So it's not just, hey, in a traditional practice, it's literally, here you go. We don't have time to figure out how much things cost. So we just give you whatever it is, whether or not you take it, that's up to you. But in our model, we take that time to figure out, can you really take this medicine? If it's going to, I had a patient yesterday who needed a medication that was going to be $800. There's no way she's going to take $800 for 30 days.
Wow.
There's no way she's going to take that. So if I were not in the direct primary care model, I wouldn't think about that. I would just give it to her and hope she figures it out. But knowing her situation, I knew that wasn't going to happen. So we talked about other options. And I think those conversations are really important, especially in primary care.
Oh, it's huge. And what I tell people is, there's a reason why hospitals are acquiring physicians' practices. And there's a reason why United Healthcare is acquiring doctors' offices and physician practices as well. It's because that's the starting point for a lot of money. And so it's kind of like, I don't know if you know who Dave Chase is, but he says primary care is kind of like the milk in the back of the store. There's a reason why it's in the back of the store, because you pass all of this other stuff that you don't know that you need, but you pick it up along the way. To use another food reference, I kind of equate going into a healthcare system like going into a convenience store to buy groceries. You can get a lot of stuff there, but it's super, super expensive. And so within a direct primary care model, you have choice, you can discern, but then you also can identify solutions that are more affordable for folks. And I think most folks miss that. They think, I don't want to spend $95 or $100 a month to see a doctor when I may not see them. And it's like, no, but that's why you need to do it. It's because she knows so much more about where to send you, so you don't have to think about it.
Right.
And that's that is such an underserved point about direct primary care.
And one more point I'll make with that is you can literally you can recoup your membership fee with avoiding one emergency room, or even one urgent care visit. Yep. So the fact that you can contact us directly prevents you from having to go a lot of times to urgent care and sometimes to emergency room, which can really, really save you a lot of money. The fact that we can do, I had a patient the other day who needed an MRI. We got her somewhere same day. That will, very rarely happen in a traditional care practice. I'll just have sent her to the emergency room because I wouldn't have time to coordinate that level of care. So it makes a huge difference.
What I want to talk about two more things. And one is, what is the typical experience when somebody engages you? I imagine there's an initial consult. You've already mentioned 24/7 availability. But what's the preference of folks, and how much more do you hear from them given your membership model?
Yeah, so it depends on the person and what they need. So they come in the first visit, usually that's a longer visit, where we figure out what's going on and all of that. And then based on what we find, we determine how often they need to come in. Some people literally come in monthly, some people come in every 6 months. It just depends on what they need. But we can, tailor that. Some people will call more often than they come in. Some people will use the video visits more often. But I think many of our members they utilize the service, and we want them to. I'd rather hear about, the cold or the COVID today than hear about it 3 weeks later. So it's good that they let me know what's going on. I feel like I understand what's happening, if they've had antibiotics or not, instead of them going to random places and it's harder to put the pieces of the puzzle together.
I would imagine, so that what I've heard is really cool. It's like, look, hey, the first visit, we've got to get to know each other. And that's just good medicine. And then after that, it's really your preference. You could be like me, the OLD guy that needs to go to a building and knock on a door, or you can do text or video chat or whatever
Exactly.
So for the millennials and invincibles that are out there, it's a good conversation, right?
Yep.
But that's, to me, as my experience has been, it's been such a delightful experience because of the transformational impact you can have on individual lives.
Absolutely.
What the challenge is, that's the biggest barrier, is not necessarily fear. It's, well, I don't want to spend that $95. And it's like, well, that's why you need to spend it, right? What I want to talk about next is how do you help small and medium-sized businesses locally?
Yes, and I think that's a great question, because this model is perfect for business owners. Perfect. because many business owners struggle to provide any health care for themselves or for their employees. And this model allows them to do this at a very affordable price, number one. And then the other thing, the access to care that it allows makes it much easier for them to get back to work, much easier for the employees to get back to work, also gives them something to give, a benefit option for their employees so that they can recruit, much needed talent. So business owners, I think, really, really can take advantage of this. And the ones that have saved quite a bit and are very happy with the personalized care.
And is it safe to say that you can differentiate the employee experience? And so if it's a large enough employer, I'm assuming you make house calls or a business call to where if there's enough people there.
Yes. If there are enough people in a space that and that's what that works for the business owners, yes, we can absolutely go over there and provide care, which is such a convenient service for business owners as well.
Yeah, it's bringing the notion of healthcare to you.
Exactly.
That's just another way to differentiate a relationship. And so what I typically tell business owners is that they're looking at that $95 as well, times 25, times 50, times 100, times whatever. And it's a big number. But then when you say, look, how much are you spending now? How much are you wasting on care that doesn't serve you? Because most of healthcare, at least depending on who you ask, 35 to 50% is just pure waste. That doesn't necessarily mean it doesn't go to provide medicine. It's just, it may not need to happen, could be fraud, or you could have that service in a better place that actually saves a ton of money. And my notion is, hey, look, if you look at the economics of health care, it feeds insurance. And so that if you can redirect people to a better place of care and pull primary care out of the insurance equation,
exactly.
That doesn't need to be an insurance product, but it goes to say that the less you pay in claims, the lower your premium rate will be. And if you have an advocate that's defending your dollars by sending to cash pay providers, by sending to high quality physicians that we know already kind of are in this cash pay or convenient model, you can have a dramatic impact today that drives a huge level of savings going forward into future years. And so as an employee retention tool and just a profitability tool, this can transform your culture. And so exactly. I'm talking too much now, but what are your thoughts on what I just said?
Oh, you're absolutely right. You're absolutely right. I wish I could somehow, we try to explain it to business owners. It's just that healthcare is complex and people are so used to doing it a certain way that sometimes it's hard for them to change. But business owners, this is really a no-brainer. It's such a great model for them.
So let me ask you, you said your office is in Sugar Land, but what areas of the world do you serve?
So anyone you mean in the Houston area?
Yeah, I would imagine. So if somebody is here in Sugar Land or in the Houston area, they're a primary customer that you could serve.
Absolutely. So anyone in the Houston area, anyone in Texas, really, because I have a Texas license. Okay. So anyone in Texas can use our services. For those that I do have people that maybe travel for work, and they can do video visits when they're here, then they can see me in person. So we really can help, anyone in Texas. And then people that come in internationally also benefit from the direct primary care model because a lot of them don't have insurance. And so this, at least we can help them with this to navigate the health system, get some much needed care and all that kind of stuff too. So it does serve a number of people.
Yeah. And so I imagine that for me, it's okay, if my kid's away at college, yes. That's a perfect relationship. Or if I'm here, we establish a relationship, and let's just say I moved to Austin, which I wouldn't, but let's just say I moved to Austin. We can still have that relationship, and absolutely. I would imagine that still works. Yes. But if I move to Louisiana are you still able to stay my doctor, or would you recommend a transition at that point?
So it depends on how long you're in Louisiana for. So if you're coming back to Texas, so that does happen with doctor-patient relationships all the time. But if you are moving to Louisiana, then at that point, it's probably better you find a doctor there. But if you're in and out, you're here often, you just go there, sometimes, then that's perfectly fine. We can still go ahead and, do video visits when needed. And when you're back in, we can see you in person.
Yeah, the point is you have a very flexible model.
That's right.
Allow for engagement. If you're in Texas, you're going to stay and live in Texas. But even if you're traveling, that connection is super important. So anything that I missed that you want to, was screaming in your mind, hey, ask me this question. Right?
No, I think that was it. I think you asked a lot of, you highlighted a lot of the benefits of the direct primary care model. There are a lot of them. And I think a lot of people have really benefited from it. And so it's nice that we're getting the word out.
Agreed. So if people want to get a hold of you, how do they do that?
So they can call our office. It's 713-280-9985. And they can go on our website, which is intouchprimarycare.com, INTOUCH.com, and primarycare.com. So that's those are good starting points. And then they can find all our social media handles and all that stuff on the website.
Fantastic. Dr. Lola Ashaye. Ashaye?
Ashaye.
Ashaye, gosh, thank you. I should have asked for that clarity up front. But it's delightful to get to know you. And the fact that you're right down the street from me just means, hopefully we can serve businesses together, because the combination of you as a doctor, me as a benefit advocate that fully embraces direct primary care and can help businesses show the financial impact to individuals and businesses is it's a good combination. So I'm grateful for the opportunity to talk with you, and I can't wait to see how we can help each other.
Yeah, absolutely. Thank you, Mike. This is great. I'm very excited to work with you as well.